The stories in the news that are worth your time. Montreal Now.
Montreal Now with Aaron Rand and Natasha Hall.
Welcome back. David Heurtel in for Aaron and Natasha. Time to be joined by Dr. Christopher Labos. He's a cardiologist with a degree in epidemiology who can be heard at 8:10 on Sunday mornings on CJD 800 on Weekends with Ken. Dr. Labos, always a pleasure.
Always a pleasure for me too, sir.
Thank you, sir. So I'm sort of happy that we're talking during the holidays and we're not in the midst of a total pandemic crisis, because that's how we first started talking together back in 2020, 2021, 21-22. Yet we have very, very, how should I say, worrying numbers. Over 1 million Quebecers infected with respiratory viruses. COVID is still with us, regardless of what people may think. With the past 3 years under your belt, how do you feel about the situation here in Montreal and in Quebec?
It's an interesting problem because on the one hand, we're not facing the same type of acute crisis where we were facing at the beginning of 2020 when the pandemic started. But we are still facing a lot of strain on the healthcare system. And I think what a lot of people don't realize is that even before COVID, just influenza and all the other respiratory viruses like RSV would put a lot of strain on the hospital system every year. And if you ever had to call the hospital during the winter months, they would always say, we're facing a lot of flu cases. If it's not urgent, please don't come to the emergency room, all the things you're hearing now. But because of the pandemic, now not only do you have COVID, which is increasing the number of people that are showing up to ERs, but you also have all the healthcare workers that got burnt out, that are on sick leave, that quit the system. And so you have more demand, you have less supply, and so the strain that we put on our healthcare system has just gotten worse. And I don't know what the long-term implications of that are going to be, because I think a lot of people are sort of like blissfully unaware as to how things are, and then they come to you for something and they find out there's like a 1-year wait to get tested, and they are genuinely shocked at how bad things are. And I don't think they fully appreciate what it means to wait 18 hours to be seen when you go to the emergency room. I think that's the type of thing that you don't fully process when you're in your 20s, 30s, 40s, even in your 50s, and haven't really been sick before.
What's the feeling right now on the floors? I mean, in the ER, in the hospitals. I mean, we've been talking about the public sector workers' strike for months now, but a lot over the last couple of weeks. But we've been focusing on the teachers and the sports staff in the schools, but it's also affecting the hospitals. Now, the strikes aren't at the same level, of course, because nurses and healthcare professionals are considered essential service staff. But how has that affected the work in the hospitals or the morale at the very least?
So there's an interesting joke that's going around when doctors speak to each other, other healthcare professionals speak to each other, and the joke is, don't get sick. And like when people ask for health advice, the advice is just don't get sick right now, because you don't want to have to try to access services. It's not that it's impossible, and of course, if you're critically ill, you will get seen. But all of the non-critical stuff takes so much longer, and again, that's the reality that most people don't fully appreciate. So while it is a joke and we say it and we laugh because, of course, don't get sick would be like a self-intuitive thing.
Sure.
But it does speak to what the public health messaging has essentially become, to be like, listen, you don't really want to get sick right now because you think if you have, a bad bronchitis because of a respiratory infection, you'll be able to go to the hospital, get a prescription for antibiotics, and be out within the hour. And that's just not the reality of the situation. Or you might think that you're going to be able to go to a walk-in clinic until you realize, none of the walk-in clinics around me have available appointments. I'm going to have to drive an hour to make an appointment at a walk-in clinic. There's something very paradoxical about having to make an appointment at a Saint-Rendezvous clinic, right? There was a time when that would have struck us as bizarre, and we've normalized it now. So it's harder for people. It's much harder to navigate the healthcare system than people realize. And that's really the advice right now. People's like, look, just don't get sick. Like, don't think you're going to be able to fix things easily. You're going to be able to fix them, but it's going to be hard. And that's why, the old adage proves true. An ounce of prevention is worth a pound of cure.
So, especially with all the viruses that are going around on the respiratory side of things, I mean, is it vaccines? Is it masking? I'm still seeing some people masking. I mean, there are definitely some people that are masking, not as much as during the pandemic. But what's the best advice if you want to be more vigilant in terms of prevention?
Well, it's a multi-pronged approach. So if you haven't gotten your vaccines, get your vaccines, because that's probably what's going to make the difference between you ending up in hospital and you being able to ride out an infection at home. Mm-hmm. So COVID and influenza. And if you're a senior and have some disposable income and you want to get the RSV vaccine, not covered by the government, unfortunately, at least for this year, but it's certainly going to make a difference. Masking, yeah, I would. If you're going to be in a public setting, a bus, metro, or if you're going to like a store which is going to be crowded, yeah, I would wear a mask because you're less likely to get sick. And here's the thing: all the people that are going to quote unquote look at you funny at the grocery store if you wear a mask, they're not going to come home and take care of you if you get sick. So
right.
I'm not sure you should care what they think about. Mm-hmm. And the other thing, and unfortunately, the one thing that we haven't really talked about all that much, or we haven't been able to communicate to the public, is improve the air quality at your home and business. If you are working in an office, getting air filters is going to clean the air. It means your coworkers won't be able to infect you. And so do that at work and do that at home. Improve the ventilation in your home. That makes a difference. But that's a much harder thing for people to do because it requires sort of engineers. It requires building specs. And that's not the main thing a lot of people have direct control over, apart from getting portable air filters for your place of business. And in the schools where they've done it, we've seen a drop in infections and sick days in schools. So we just have to sort of apply that population-wide.
Important insights, as always. Dr. Labos, appreciate your time today.
My pleasure. You take care.
You too. Dr. Christopher Labos is a cardiologist with a degree in epidemiology who can be heard at 8:10 on Sunday mornings on CJAD 800s, on weekends with Ken.